submit a question in writing to you. Thank you. Thank you, Mr. Chairman.
Senator Stabenow.
Well, thank you so much, Mr. Chairman and Ranking Member Daines. So it's very, very important hearing. I've been working on these issues, I think, most of my professional life, and certainly starting in the House of Representatives. I can't thank all of you enough for your very important testimony. For the life of me, I can never understand how, as we move forward on healthcare policy, one of the proposals is always somehow to cut home health care, even though people want more home health care, even though during the pandemic and now afterwards we're seeing increased needs as a result of this, but somehow that's always home health care payments are always a part of the equation, which I think is the opposite of what we should be doing. So I also want to say that we know we have serious workforce shortages that need to be addressed in so many areas, and we need to continue to be doing that. I do have to say I appreciate this support that's been given for the bill that Senator Collins and I have, Preserving Access to Home Health Care Act. I think it would provide the certainty and stability to home health care providers that's needed right now by preventing additional cuts. I hope, Mr. Chairman, we'll be able to move forward on that as quickly as possible. But let me start, Ms. Edwards, with you first. Thank you so much for coming and telling your story and for supporting our legislation. One of the things that I kept thinking about, though, as you were talking, you keep shrinking your service area, right? So you've got 13 counties. Now you have one county. What happens to the rest of the people in those other counties? What's happening for them?
Thank you for the question. They have options for other home health agencies. Many don't serve the full county they're in. Many of them won't accept those higher need patients, or again, like I mentioned before, they might not be in contract with the payer. So a lot of them,
they're just not getting service.
They're not getting service.
Or they maybe get really, really sick and they end up in the hospital, right?
Or
someplace else.
If they're referred from the hospital, they might end up staying there longer. We've had patients in the hospital for 40, 50, sometimes 200 days because there's no place for them to go.
And so it really is, it's like the proverbial punching bag, is right. If we're not providing adequate home health care for people, they could very much end up in the hospital at higher cost care, or not getting any care and then getting sicker and then something else happening. And so home health care is incredibly important in the equation for people, and it's what people want.
Yes.
People want for themselves and their families. Let me ask Mr. Dumby, in talking about payments, I mean, it's people, but we have to talk about reimbursement because that's how we get the services and pay for the workers to be able to provide the services that people need. Could you talk a little bit more about the current and proposed payment policies that are cuts? I mean, let's just call it what it is. It's cuts. And really what that means for the average provider of home health services.
I mean, as you noted, there is an intimate relationship between payment and service. I'm really tired of talking about payment policy and payment rates, but it's still essential to do so. Medicaire's proposal would cut payment rates by 5.653% in 2024, and there's a $3.5 billion quote-unquote debt hanging over the heads of home health agencies right now, contributing to their anxiety. Combine that with the fact that there was a forecasting error in the inflation rate that led to rate changes for home health agencies, a shortage of 5.2% for the years 21 and 22, when particularly labor costs rose significantly. That's now baked in permanently into the payment rate. So that 5% shortfall will continue ad infinitum. CMS has refused to correct that forecasting error. So when we're looking at it, it adds up. CMS added it up itself, $870 million reduction in spending for home health just in 2024. And that 870 will repeat itself over and over and over again for the rest of the Medicare home health benefits life. So we're really talking, you know, some long-term negative impacts as a result of that. And these are on top of cuts that took place in 2023. And so the other thing that stands out is that CMS was required to create this new model in a budget-neutral fashion, it seems really kind of elementary when you see that spending and utilization of home health has gone down from the previous 2019 model of care in 2019. I mean, losing 500,000 patients over a short period of time should tell CMS this was not a neutral transition at all.
Thank you. Thank you, Mr. Chairman. I just want to say in concluding that we know that as we are fortunate enough to be able to live longer, and healthcare is allowing us to do that, our needs on home health care are only going to grow. And so we need to right-size this and stop putting patches on it over and over again. So thank you, Mr. Chairman.
Thank you, Senator Stabenow. Senator Cortez Masto.
Thank you. I want to thank the chairman